really challenging question for me to answer because it just feels such a part of the work that we do and a part of the life that I live every day. And so for me, public health is everywhere and is all things. The best part I think about working in public health is being able to be a part of every sector. We get to be a part of the business world. We get to be a part of the healthcare world. We get to be a part of education. We get to be a part of childcare. And we get to be a part of our community as a whole. And so for public health, to me, what's most important is that partnership and being able to bring the community together so that we can lift everybody up and have healthy outcomes for everyone.
Public health essentially means to me us getting out in our communities and helping the people who are there. I really appreciate public health because it gives you an opportunity to serve people just in the community. If you didn't have insurance, if you wanted to come get medications, it's the place where I got my work permit. So for me, public health is just a all-encompassing place where you can kind of like get physicals, where you can get taken care of, whether you have a lot of money or if you have a smaller amount of money. It's just, we're out here helping the public at all times.
Public health is working in the present to improve health outcomes and health opportunities for the future.
To me, it's like a collective of what the community does to have access to healthy foods, healthy activities such as parks, recreation, healthy stores that they can do grocery shopping, also educational places for therapy, community gardening. There's many things that I feel like public health represents as a whole, but I think number one, it starts with our community.
To me, public health is ensuring that everyone, everywhere, has equal access to health care, regardless of your location on this world, regardless of your race, regardless of your religion, and regardless of your socioeconomic status.
I think the main thing employers can do is, one, I'm a big fan of us being fairly compensated. So I would always say, like, pay your staff more, but not just paying your staff, but like making better accommodations for your staff. I'm really hoping that in the future, Cumberland County is doing great strides with telehealth. I'm hoping we'll be further along as time goes on, and we will have more things with parents with kids, for people who need to work from home, and other issues that may arise which may keep you from working in the office.
Well, since quitting tobacco is the best thing that people can do for their health, work sites can offer tobacco-free environments while also supporting their employees in the quitting process and providing the treatment that they need through their health insurance and promoting Quitline NC.
So one thing that employers can do is consider giving their employees a living wage. The Cumberland County Commissioners took action to do this in July 22 to assure that everybody on our pay scale earned at least a living wage. Other things that employers can do is consider the policies and practices they have in place, and making sure that it considers equity and promotes healthy lifestyles and behavior. So for example, having tobacco-free campuses, making sure that you have breastfeeding policies that are supportive of breastfeeding moms, providing that space and time for our breastfeeding mothers and individuals to take care of their children. So those are just a few things I think we can do to promote having a healthy workplace.
The Cumberland County Fort Bragg Food Policy Council's vision is to advance health equity and quality of life by creating a healthy food environment where all members of Fort Bragg and Cumberland County communities can thrive.
I think that collectively, with everybody uniquely coming from different walks of life, we can address the issue head on and maybe lower the impact by talking to our neighbors to see what they need, being a helping hand, and essentially doing it from a place of giving.
So climate change impacts many of our health outcomes. If we think about the ways that climate change impact our communities, it warms up our weather, so we have longer, warmer seasons, which may mean more Lyme disease, more opportunities for Zika in our community, and in communities around the world. That may mean more wildfires or more flooding or more hurricanes. And so as we think about investment in addressing those things, we need to invest in our emergency services and invest in our public health preparedness programs. And so that when those events happen in our community, we're better able to respond. We can more readily set up shelters, provide mosquito dunks. And if we invest in our public health preparedness programs, we can also help to address the impacts of climate change on our health. Well, I think it starts with our workforce. So we want to make sure we have a workforce that reflects and celebrates the diversity that's in our community. And so we do that through our hiring practices. We at the health department have a blind application process, and we do have diverse interview panels that will help us to remove or limit bias from our hiring practice. We also want to think about using data-driven approaches when we plan our programs and services. So we want to make sure we identify what those inequities are, those racial inequities are in our community, and then targeting our programs in areas and census tracts and zip codes where those inequities appear the most. We also want to think about making sure our staff are well trained and well equipped to provide services that consider people's culture, consider people's and celebrate their cultures, think about health literacy, thinking about being able to provide services in a language that people can understand and are comfortable with. And we want to implement that in all of our programs and services.
I provide racial equity by ensuring and working towards everyone having easy access to effective tobacco treatment that is tailored to their needs.
Of course, we really serve a variety of clients in our office. Of course, we serve anyone. WIC is a income-based program. So with that being the case, we really see all walks of life. Now, with our office, we are very diverse as well. So it gives us the opportunity when things happen or when things are in the news, we get a chance to discuss them. Now, of course, do we always agree on all of those things? The answer is no. But with us having a diverse staff and diverse participants, we can discuss and potentially talk about those issues that are going on in our community. I don't know officially how we will break that stigma, because I believe the stigma has been around for a very, very long time. I do believe that we're making great strides at breaking that stigma by all of the promotions that we have put out with mental health, with us doing the commercials, really having the lines for people to call and that are open so that people have access to it. But I really believe it's going to take a longer time and an all-encompassing effort from all of us on the individual level and on a family level, because you're really going to talk to your families about, hey, there's nothing wrong with getting help. But I believe that we are getting the message out. I'm hoping that as time goes on, we will continue to put that message out through health ed, through the whole health department and all of our departments. Because at some point, all of our departments are impacted by mental health, whether it is a parent, a pregnant mom, someone who is working in a food truck, which is with environmental health, or just one of the staff members. So we can all be impacted by mental health. And I think having all of those avenues available to staff and to our community is really going to help us break that stigma. But it will take more time.
So I think one of the primary things, we got to take a few steps back and think about who is in our mental health care workforce. Nationwide, if we look at our psychiatrists and our psychologists, African Americans only make up about 2 to 4% of those professions. If we look at, and those numbers are very similar for Hispanic individuals. So if we think about accessing mental health care services, not only do we have to access make sure we have a provider that takes our insurance, has hours that are accessible to us, but also someone that understands our culture, someone that can speak the language that we're comfortable with. We are limiting ourselves if we don't have a pipeline and a workforce that reflects the diversity in our community. In addition, we need to talk about mental health in the same way that we talk about physical health. We think about smoking cessation, or thinking about weight loss prevention or weight loss services, or thinking about getting your annual checkup. We need to talk about mental health in the same way to make it a cultural norm for us to access those services.
We just need to be mindful of our own selves, on our own health, while also practicing empathy for other people. But if we're all really honest with ourselves, we all struggle with some mental health issue in one season or another.
We want to make sure that our community members, whether they have health insurance or they're uninsured or underinsured, have access to healthcare services. And so we do this in a few different ways at the health department. Some of our services are free and no cost to the community members. For example, our communicable disease services, our STD testing. You can also get a COVID vaccine or a COVID test for free at no cost at the health department. We also participate in federal programs like the Vaccines for Children program, which provides vaccines at no cost to our community members. Other services that we provide are on a sliding fee scale. For example, our family planning services. That means those that are the most vulnerable in our community will pay the least amount of money to assure that they also have access to healthcare services. We're also really happy to partner with Cumberland HealthNet and Stedman Wade, who provide adult health services in our building and helps assure accessibility to those basic healthcare services. And if we are able to increase capacity to provide those services, that really improves the health of all of our community members.
We've been making phone calls to clients to actually do their work appointments over the phone. We've really been trying to make sure that we issue to everyone, even if they're unable to come to their appointments, just to make sure that they're able to get their basic needs. Now, again, like I said, hopefully in the future we'll have more telework options. We don't have them now, but the WIC program is working on those. And of course, we've been doing night clinic hours, of course, only once a month. But that's because, again, we're working on ways to actually be in the building late night with security. But we are offering later night hours for clients who work. So I think that's allowing us to be a little bit more accessible to clients.
I feel like we can improve in ways that essentially we are a part of the community. Being that the Food Policy Council has come together, there's a lot of uniquely qualified members that are longtime natives as well as veterans. I believe that we can make an impact as far as getting engaged with the community, speaking with them as far as what their needs are, and addressing those needs collectively as a unit.
We can all improve community in our county by believing in ourselves and trusting in our neighbors and trusting in our services that are here in our county to meet our needs.
Health is about where you live, work, learn, and if you so choose, to pray. And that means in order to improve the health of our community, we need to collaborate with partners in all of those different sectors. We need to partner with our schools and our K through 12 universities. We need to partner with our institutions of faith. We need to make sure that we are partnering with our businesses so that we can truly impact health where people live, work, learn, and play. And so for me, that means one word, that means collaboration.